Hi, today we are going to talk about oral oncology, or that is becoming an oral cancer specialist after BDS and MDS. To explain us more about this entire field, we have with us Dr. Hitesh Singhavi. Dr. Hitesh, after completing his BDS and MDS in oral and maxillofacial surgery, then went on to do his fellowship in oral oncology at the Tata Memorial Hospital. He was also working as a research associate in University of Minnesota, USA. He has published more than 65 articles in both national and international journals. Other than that, he's also authored two chapters in a book named Comprehensive Management of Head and Neck Cancer. He's won various awards, including the Chaitra Navratna Award. He's also performed various robotic head and neck surgeries. Currently, he is working as a consultant in various top-notch hospitals across Mumbai. He is also a founder of the ROCH Foundation. I'm Dr. Satish Kumar. This is Kaizen Dental. Our aim here is to help dentists succeed. Hi, Dr. Hitesh. Thank you for joining us today. So, my first question to you is why did you decide to do oral oncology after MDS in oral and maxillofacial surgery when you had other options like cleft palate, advanced implantology, facial cosmetology? Why do you select this field?
So normally, all my dental colleagues, even maxillofacial surgeons, they ask me this question: that why did you choose oral oncology after MDS? So here I want to correct them. I choose oral oncology after my BDS. So what happened was I wanted. It's a story of all BDS. 80% of all the BDS people, they want to do MBBS and they land up taking a BDS seat. And same goes for me. I was getting MBBS in Akola, but then because of familial reasons, I could not go there. So I took opinions from Dr. Mansingh Pawar, Dr. Dimple Padave madam, and my father convinced me that yes, there is an option of surgery from dentistry, and you're getting a seat, merit seat from St. George. Just take it and pursue oral surgery. So while pursuing oral surgery, I came across a lecture from Dr. Pankaj Chaturvedi, who's currently a deputy director at Tata Memorial Hospital. And what I saw, what he said was there is a lot of oral cancer patients, and there's a dearth of oral cancer surgeons. We see about 1,35,000 new oral cancer cases every year, but the ratio is not very great as far as new oral cancer surgeons are concerned. They come out in a very less quantity, and even if they come out, they are more in urban areas and less in remote areas. So I felt there is a need, and second, it gives you a power of saving lives. So that power, that feel that you can save life, pushed me towards taking something called as oral oncology. That is a branch where you can save lives from oral cancer, become a cancer surgeon. So I took this decision when I was in my internship that I have to do oral oncology after oral surgery. So oral surgery decision was taken before BDS and oral oncology before entering MDS.
Great. So, you did a fellowship after you finish your MDS. What are the various top fellowships which are available if someone wants to get into the field?
There are many fellowships available nowadays online. They are structured fellowship. When I was maybe in 2014-15, when I finished my MDS, there were not many structured fellowship. So fortunately, there are many structured fellowship available now through organization or through associations. So through association, it is like through FHNO, Foundation of Head Neck Oncology Association. They gave you a fellowship through exam, and also same goes up for AOMSI. And there are also institutional fellowship available, like in Tata Memorial Hospital, there is something called as HBNI fellowship. There is an exam, an entrance exam, MCQ entrance exam, and also an interview when you pass MCQ exam somewhere in July and August. You apply online, and if you pass through, you get a two-year fellowship course in Tata Memorial Hospital. So there are if I counted on fingers, there were about 4 to 5 fellowships when I entered fellowships opportunities, but now there are about 20. I can provide the entire list so that we can, our listeners or audiences can have the complete data of it.
Great. We'll put that in our Instagram page, in which we'll be tagging your Instagram page as well, so you can share it across. My
Absolutely.
next question is it important? Now, there are so many fellowships available. Is it important from where you do it? Uh, uh, you have a difference of how you learn and how you come out, or any fellowship is well and good.
Yeah. So many people ask me, sir, क्या institute matter करते हैं? Whether BDS institute matters or MDS institute matters or your fellowship institute matters. It matters a lot, but the most important institute which matters to you is the part you which are going to practice. For example, if I'm going to practice oral oncology, the experience in Tata Memorial Hospital will matter the most. It doesn't matter if I come from Nair or GDC or Terna or any other private institute. But if my fellowship is from Tata Memorial Hospital, and if I'm going to practice that, that will definitely matter a lot. So to answer your question, yes, the place where you do fellowship, if you're practicing that for lifelong, it is going to make a hell lot of a difference, because the kind of volume the institute gives you, the kind of mentorship the institute gives you, or even the your guide gives you, and most importantly, the culture of that institute will be imbibed in you, and you will practice that for lifelong. So yes, institute will make a lot of difference as far as oral oncology is concerned.
Understood. Now, you already made up your mind during BDS that you wanted to do get into oral oncology. But there is always a journey. Okay, people see where you reached, but they don't see the hard work behind it. So, how was your shift from having a dentist mindset to a surgeon's mindset and finally to an oral oncologist mindset? How did that whole thing come across?
Of course, there was a huge shift from being a dentist. So, being a dentist, you take care of what is happening within the oral cavity. And being an oral oncosurgeon, though it is oral oncosurgeon, but you have to take care of the entire body. So, when you're doing a cancer surgery, the entire body has to undergo a fitness, and that those fitness have all kind of organ system which are screened, and you need to know at least a screening part of each and every organ of the body. So, it makes a lot of difference on how you see the patient. So shift of mindset happened especially after BDS. Even in oral surgery, you get to know a lot of things about, I would say, bleeding time, clotting time, MI, it is myocardial infarction, cardiovascular systems, neurovascular systems, and that plays a big role while practicing oral oncology, because oral cancer do not come alone. It comes sometimes with a history of CABG. It comes sometimes with a history of liver transplant. It comes sometimes with a history of angioplasty. So a lot of vascular systems in the body, where oral cancer normally, if you see, the incidence is between 50 to 60 years of age. So a lot of diseases which comes before that. So even the idea, the usual mechanism of how they are treated makes a lot of difference in treating oral cancers.
Understood. But did you face any difficulties or challenges when you made this shift, or was it a smooth sail?
So there was a lot of challenges, a lot of emotional challenges, a lot of challenges from your own fraternity, and of course outside your fraternity. So just to give you an example, a lot of friends of mine, I used to say कि नहीं भाई मुझे तो I want to do oral cancer, I want to practice oral cancer. You tell me, अरे तेरे बाजू में कोई MBBS MS MCH बैठा रहेगा, और तू if you're doing MDS, if you are MDS and you want to practice oral oncology, why should a patient come to you? So that used to give me a lot of resistance कि क्या ऐसे होगा, patients आएंगे मेरे पास. But I think you have to take that leap of faith. Passion, hard work, and good training takes makes you I think it will take you a long way in getting all those things possible, which is impossible for others. So I took that leap of faith कि yes, मुझे तो करना ही है oral cancer surgery, though I don't didn't have many of the ideals like कि हाँ मुझे इन जैसे बनना है, मुझे उन जैसे बनना है, because they were all MSCNTs, general surgeons and etc. बहुत कम लोग थे, डॉक्टर सागर इज वन ऑफ देम, जिनको हम देख सकते हैं कि हाँ इन जैसे हम ये रूट ले सकते हैं. There's a lot of difference between moving on the highway and moving in the forest, because highway is a structured path where you know कि गाड़ी कहाँ से आने वाली है, but the path which I took is like a forest. You do not know where exactly आपको रास्ता खुद बनाना है और खुद पहुंचना है. But good thing is once you cross that path, you don't have lot many people behind you and with you. You are only few in numbers in Bombay. So when I got attachment in Fortis Hospital, I think I was one of the first maxillofacial surgeon in Mumbai getting a corporate attachment as a head in the cancer surgery.
Understood. So the thing is, you had to find your own journey. But the best part is you're taking your time out here to help and guide the youngsters. So I would like to thank you again for that. Okay. Now this is for people who did BDS, MDS, and then got into oncosurgery. Are there other dentists like general dentists who have just done BDS or other fields who can work on oral oncology patients?
Absolutely. So when you leave apart maxillofacial surgeons, there are also 4 to 5 fields where dentists can capture those areas and help serve people live a better life with cancer and even without cancer. So when I say with cancer, there's a lot of patients who are palliative. हमको पता है कि इनमें treatment नहीं है, treatment कोई लागू होने नहीं वाला है. In that case, also a dentist can play a big role in the form of maxillofacial prosthodontist and even dental surgeon who can make obturators. Now, for example, there's an oroantral fistula. They're not able to eat, drink because of some reason. Okay, but if you can give obturator in that palliative patient, at least for whatever life he is living, there will be an added quality of life because of you. As far as without cancer is concerned, a dental surgeon is the sentinel to oral cancer. Sentinel is a person who guards the oral cavity. Oral cancer screening is completely dependent on dentists. Now, if you see the literature, according to one study which was done by Shankar Narayana in 2005, if you can screen high risk individuals, at least tobacco chewers, areca nut chewers, alcohol drinkers, you're able to save 40,000 lives every year,
Wow.
even without operating. So you don't need to operate like me. You have to just screen the patient, especially the high risk individuals. It is 38% reduction in the mortality rate. So if you see, there is 1,34,000 new oral cancer cases arising every year. So 40% of that you'll be able to save is around about 40%. So that is oral cancer screening. Then we move to, yes, we see there is a leukoplakia patch or some erythroplakia patch in the oral cavity. The dentist diagnoses it in the right stage, in early stage. He takes a biopsy. So he's a person who can even take a biopsy. Take a biopsy, prove it. If it is early oral cancer, survival is more than 90%. If it is advanced, it is less than 60%. Unfortunately, 70% of all the Indian oral cavity cancers are in advanced stage. So if we can capture that window, we'll be able to diagnose these lesions in early stage and therefore significantly affecting the survival and the quality of life of the patient. That is screening. Once you diagnose this lesion, you know whom the patient should go to. According to our study, our own Indian study, there is 7-month delay in the treatment of oral cancer. We can shorten this delay, and inadvertently you are reducing the stage of the oral cavity cancer. So there are a lot of stages where dentists can contribute, right from prevention to diagnosis to palliative patients, and also being a prosthodontist, you can play a very important role in an upcoming branch called oral cancer rehabilitation, where you place implants in fibula. You'll not only save the life of the patient, but you also make sure that he eats with the same fibula which we reconsidered about a year back.
Understood. So they do not, if they cannot become an oral maxillofacial surgeon and get into oral oncology, there are other ways where dentists can serve the oral cancer community. Now you told
Just
me
to
that
give you an insight, and just I'm sorry I cut to here. just to give another insight, another segment is being developed by Dr. Pankaj Chaturvedi called Oral Cancer Warriors.
Okay.
Now, yes, so oral cancer warriors, majority of them, they are either maxillofacial surgeon practicing oral oncology or dentists. So, and we are specially emphasizing, sorry, yes, we are emphasizing on district hospitals where these dentists are empowered to diagnose these lesions and detect it and even excise it in the same hospital.
Understood.
So, yeah, so even the government is now making efforts. They're putting their bet behind the dentist so that we are able to diagnose this lesion in early stages.
Got it. So now you told me that you got an opportunity to join Fortis and you're also associated with other hospitals as well. If a new oncosurgeon, once he just finishes his fellowship, are there enough opportunities and how do they find these opportunities? Before you listen to answer to that question, if you're liking this video, do not forget to hit the like button below because it shows YouTube that you enjoy such videos and shows you more such content. Other than that, if you're not subscribed to our channel, I would advise you to please do so because we keep on coming up with content which will help you take your dental career to the next level.
So, yes, there are enough opportunities. How? So, what I would say first, I'll just tell you how I found this opportunity. Is I after my MDS, I was in data for 4 years. So there are a lot of seniors, oral oncosurgeon. There are a lot of surgical oncologists who see the entire body, means who look after the surgery part of the entire body of the cancer. And there are a lot of ENT surgeons who are practicing head and neck oncology. Okay. After a certain point in time, they require help. 10 years, for example, 10 years down the line, 5 years down the line, you almost operate every day and you require an assist. So the person who has just passed out from fellowship of oral oncology can assist all of these people, surgical oncologist, previously experienced oral oncosurgeon, ENT specialist who are practicing as head and neck oncosurgeon, and slowly move on to making the patient base of their own. So if you see these numbers in the last 4 years, I have operated more than 500 cases of my own. And now what is happening is patients are referring patients. So your own patients who got cured of cancer, they refer their relatives, their family members to you. That is where you understand that whatever job you are doing has some credibility.
Understood. Now, what are the traits one needs to have to get into oncosurgery?
Uh, I think passion is the most important trait with patience. I think these are two contradictory qualities to be possessed by a single person. If you're passionate enough, but you're not patient enough, I think it is very difficult to achieve um, this kind of practice because passion is required to be consistent enough for a long period of time. For example, if you want to practice this field, you have to at least have an experience of about 3 to 4 years after your MDS. So, an average age of a person in MDS once he or she passes MDS is somewhere around 27, 28, 29, and then 3 years more, 4 years more, it is somewhere 33. So you should have that vision that I'll be learning and getting myself trained till the age of 32 and 33 without getting paid. So if you can pursue that kind of training for yourself, then there is no limit for you also and also for getting patients in day-to-day basis.
Understood. Now, when you're doing all these surgeries, is there any requirement for getting into research? Are publications important, or only you focus on the surgical aspects of it?
So having experience from Tata Memorial Hospital, I think you don't have an option. You have to do research. Being in Tata Memorial Hospital, that is one good part of being from there. But apart from that, I think in upcoming 10 years, the most important part will not be gold, will not be dollars, it will be data. So if you do not know how to conserve and preserve data, how to use data, then I think artificial intelligence will take you over. So it's very important that you conserve and preserve your own data and improvise on it. And conserving and preserving data is through research. That is one part of it. Second, you say I have done 1,000 surgeries, 5,000 surgeries, it won't make a difference. But if my paper says that in my experience of 500 surgeries, we observe this makes a difference in survival, then every professor on this planet will acknowledge your efforts in the field. So you don't have to prove to anyone. This is the best way to say that you are best in the business.
Understood. So we should not just focus on the surgical aspect. Focusing on research and publication is equally important if you want to make a mark in this field.
Absolutely.
Other than the surgeries you do and the research you publish, are there any innovative fields you're getting into or any philanthropic activities you're attached with?
So, with my experience at Tata Memorial Hospital, I think they had sent me to University of Minnesota. There, I learned a lot about tobacco carcinogenesis. That is, that there are certain tobacco-specific amines which causes certain metabolism in your body, leading to carcinogenesis, especially oral cancer. There, they always evoke a thought of whether you can do the same thing differently. Now, during my COVID times in 2020, there was a lot of fear on doing tracheostomies. So, in Fortis Hospital, I think a lot of my work is about tracheostomies also. So, just to give you a definition of what exactly tracheostomy is, we make a bypass from a trachea so that the upper airway is bypassed and we can ventilate the lung as soon as possible, and also helps in tolerating the lung. So during COVID, there was a lot of scare whether you become infected because of COVID positive patients. So we designed this tracheostomy box. It was a transparent box, especially designed for the operation table with a portal on both sides. And we used to do a tracheostomy in that box. That led to decrease in infectivity rate of patients, of even of the paramedics who had done tracheostomies. That is one part of it. Second, we are also concentrating on tracheostomy bays. Now, what is tracheostomy bay? In that, we keep all the tracheostomized patients in one ward. So that has led to decrease in length of stay by 2 to 3 days. Decrease in length of decannulation time. That means patient returns to speech 3 days before what he used to do if they're not in tracheostomy bay. So I am trying to do research even outside the institution, because that seed is being sown in me when I was doing my fellowship. And as far as innovation is concerned, I think there are a lot of things we are still not discovered, or things can be done in a different way with much better results.
Understood. So what philanthropic activities you are associated with?
Oh, yeah. So, my father passed away about 3 years back, and of course not because of cancer, but he used to push me and even my brother towards betterment of society. So we registered this trust on his name. It's called ROCH, Rajendra Oncology, Cancer and Health. Now in that, since last 5 years, we do camps for all the needy individuals. We not only do camps, we also done mammographies. We have also done some investigation free of cost. And if you see the numbers, we have catered to about 8,000 individuals, and 5,000 individuals have got free blood investigations done. We have not only done blood investigations, we have also guided them further. So, for example, we did a cancer oriented camp in 2018 where biopsy was done stat on the campsite in dental van, and then about 3 people who tested positive, and we operated them at Tata Memorial Hospital.
Great. That's a very great initiative, and I think that's the need of the hour in our country. Since you're doing a lot of things, okay, you have seen the struggles, you have gone through a lot of things. What is your take-home advice to the young dentist who's graduating and watching this?
So my advice towards being an oral oncosurgeon, I think you need to be very passionate enough. You need to be at least 1 year in advance. That means you need to understand where I will stand after a year. For example, if you're in second year of MDS, you need to at least know if I'm doing oral oncosurgery after my BDS, after my MDS, and same goes for BDS. So if you are 1 year ahead of what you are going to do after a year's time, I think a lot of things you will acquire during your journey. A lot of activities which are required. For example, there are your USCC activity, there are conferences. You make your publications, your posters, all related to oral oncology. So you have a complete background ready or theory ready to practice oral oncology.
Understood. So they should basically plan what they want to do in the future so that they can go and follow that through. And if they do that, the path becomes easier. That's a really amazing advice, Dr. Hitesh. Thank you
Another,
for your
another
time.
I'm sorry. I want to add one more thing. I think I missed one of the most important point is to get a good mentor. I think getting a good mentor, getting a good guru makes a hell lot of a difference in how your life will move. So I want to just mention few names. I think I have a lot of people who have guided me in life, but few of them are Dr. Anil Hirur, Dr. Pankaj Chaturvedi, Dr. Sima Mazumdar. They have guided me a lot, and they have made a lot of difference in those turning points of my life where I have taken oral surgery because of oral surgery and oral cancer surgeries because of them.
Great. You're right about it. We need mentors, and that is one thing which will help us grow faster. Thanks a lot, Dr. Hitesh, for your time. Thank you for joining us today.
Pleasure is mine.
If you like this video, do not forget to go and check out our other two videos which are shown here as well, because those will also help you understanding various options after oral surgery.